Hi, my name is Ryan Plank. I'm an orthopedic surgeon with Lakeshore Bone and Joint Institute. I specialize in general orthopedics with a focus in sports medicine, meaning I perform a lot of shoulder and knee arthroscopy, but take care of all general fractures, arthritic conditions. I do total knee replacement, as well as doing a lot of pediatric fractures. I've been with Lakeshore Bone and Joint for about 4 years. Prior to that, I was active duty in the United States Army, where I was a major. I was an orthopedic surgeon in the Army for approximately 10 years prior to coming back to Indiana, and served in Hawaii, Fort Stewart, Georgia, as well as a time where I was deployed in Iraq during Operation Iraqi Freedom. I grew up in Warsaw, Indiana, just down the road east here in Indiana, east on Route 30. I went to the University of Notre Dame for undergraduate. I went to Indiana University for medical school. I then did my residency in the United States Army at Tripler Army Medical Center in Hawaii. As part of that rotation, we also did part of my training at the University of Hawaii, also at Baltimore Shock Trauma in Baltimore, Maryland. What I love most about being an orthopedic surgeon is that I get to see patients in all age groups, from the elderly to the young and active athletic patient to little kids. It makes every day a little bit different and keeps my job fun and interesting. The other thing I love about orthopedics is that I get to see someone who's hurting or can't do things that they like to do, and either through therapy or medications or surgery, get them back to their pre-injury level, whether it be returning to work, returning to sports, or just healing a fracture. My favorite orthopedic procedures to perform are ACL reconstruction, rotator cuff shoulder surgery, as well as instability in the shoulder, involving shoulder dislocations or labral tears. When I'm not working, I like to enjoy time with my family, my wife and my 3 kids. I have 11 and 8-year-old daughters and a 3-year-old son that take up most of my time. I'm also an avid Notre Dame football fan, so I spend a lot of Saturdays in the fall in South Bend. I also enjoy working out in general, in pretty much all sports. I think patients should come see me when they've sustained an injury and they're just not happy with how things are going. If you failed anti-inflammatories, time, rest, and you continue to have pain, also when joints are swollen, or you're unable to do your job or athletic activities that you'd like to do. What makes LBGI different in Northwest Indiana is I think that we really do offer university level care. We can take care of the entire musculoskeletal patient, whether it involve bone density, fractures, spine care, hand care, or any sports-related injuries. I pride myself in taking great care of the workman's comp patient. If you sustained a work injury, what you can expect is to be treated fairly. The goal is to get you back to work. Sometimes that will involve surgery, other times it will involve therapy, injections, and other modalities. Each time you see me as part of a work comp patient, we will write you new work restrictions. Again, rarely do we put anyone off work completely, but rather we give a set of restrictions and leave it up to the employer to determine whether or not they can accommodate those restrictions. I would consider it a privilege and honor to take care of you. If you would like to make an appointment with me, please call the number on the screen below.